stool may have a sign that points to a challenge that needed to be arrested quickly. Sometimes you may have heard the doctor ask that you need to give your stool for laboratory investigation. That's to tell you that that stool is important. Don't just flush it immediately and walk away. Some people don't even like to look behind them to know what came out of their body. It's your body. Hello everyone, I am Nurse Miracle Udechi and I am a registered nurse. I share health content that help to prevent diseases and promote health. Please follow me as I explain more on the signs, certain signs that your stool would be pointing to you, that to let you know that, okay, at this point I need to do this, I need to do that, and when you need to go to the hospital, certain things you need to adjust for better health and a better you. So first, a normal stool should come out easily. Most conditions like that people suffer, anal tear and the rest, most times are due to strain in the toilet. A normal stool should come out easily, and the color should be between medium to dark brown. Yes, in the biology of human, that from the bile there are certain things that are released, certain enzymes that are released that give the stool its characteristics color. So it should be between medium to dark brown. Now that's a normal stool for you. And then now for people, like there's a range. Some people use the toilet 3 times in a day, while some 3 times in a week. So but then we put the range in between, that okay, it should be either 3 times in a day, within the range, to 3 times in a week. So that means if you are having difficulty stooling, let's say you stool only once a week, there's a problem. I've met people like that and they feel everything is normal. Please, it's not normal. There are certain things you need to change in your diet, your lifestyle, for a better you. It's not normal. In the long run, it could affect certain parts of you. Some people, they say their system is cleansing themselves. They go to toilet 4, 5, 6 times in a day. It's still not normal. So you see the range, 3 times in a day minimum, and then maximum 3 times in a week. That range is safe by WHO. Okay, now that's for a normal stool. Then another type of stool, sign your stool can show, maybe you have a hard, clumpy stool that you are doing, you are struggling, you are squeezing face. In fact, so people can hear your groaning from the corner there, that you are, they'll be asking, Nkechi, is everything okay? Are you sure you are fine? And then you know what you are passing through. It's usually that is what they refer to as constipation, and this most times can be as a result of not taking enough quantity of water, either before eating or after eating. Most people drink water sparingly, as if there's a problem, they have problems with water and so on. Please, it's advisable to take enough water so that it can allow digestion, it can allow the food to move freely. Yes, another thing that can also be a cause of this hard clumpy stool is sedentary life. Being a nurse, I've noticed it a lot for patients who are bedridden, because they are lying down for a very long part of the day. They hardly move. Some of them don't even move at all, so you just care for them, everything on the bed. Most times they suffer constipation because let me tell you, this ability to move about helps the bowel to be active. And before you know, if you've noticed it, you woke up from bed, when you were lying down you were not feeling pressed, but you just got up and decided to walk to the room, to the toilet, to the kitchen, just walk around. Before you know, you start feeling pressed and you go and use the toilet, right? That is it for you. The body wakes up, and as you are moving, that movement helps the bowels to come alive, and before you know, it helps digestion. But if you are sedentary, always sitting down, always lying down, your food will be moving very slowly through the tract, and then it will not get stuck somewhere. You didn't take enough water. The one that is even in the stool now, the body will absorb them back, so the stool will now become very hard. So that's how it's come about. So please, and not drinking large quantity of water is necessary, and also exercising yourself. We encourage patients to move about. They recover quickly when they move. Just take the measurable exercise you can do, take some few walks, come back and rest, take some few, before you know, they are good and they are gone. So that is one thing. So please don't enjoy lying down and sleeping. I know some of us that are on holiday now are just enjoying sleeping, pressing their phones. Sedentary life is not healthy. The next one is a loosed or watery stool. A loose or watery stool can be pointing to diarrhea. That disease they call diarrhea. It could be that your stomach is now, there's this what they call oversensitivity, and if the trigger is too much, wanting to anything that comes, like your stomach is on a race, as you are drinking or taking anything, you are feeling the, and then the next thing you are using the toilet. That is also not healthy, because that can lead to frequent loss of water that needs to be replaced immediately. If not, can affect someone's health. Especially you listening to me, if you are a mother of an under 5 child, maybe your child is between 0 to 5 years, please, if you notice this too, don't take it for granted. This has claimed a lot of children's life. So as a nurse, I encourage you, once you notice this, please seek help, seek medical help immediately, because they are very delicate at that period. The child is 1 month, 6 months, 1 year. This tooling cannot continue, because it can affect them seriously and can really cause a lot of damage in their body. So the next is a pale or clay colored stool. A pale or clay colored stool. This points to a disease condition that it's affecting the liver. A liver disease condition. That means, because I told you that in the liver, that's where that connects, you have the gallbladder and the bile. The liver produces the bile that is stored in the gallbladder. Now, this liver, if it has a problem, is not producing this gallbladder, and this gallbladder, this bile that is being produced, that is being stored in the gallbladder, that is produced by the liver, is what gives the stool that unique color, the characteristic color. So if there's a problem with the liver, then it will not be producing, maybe the bile that is being produced is not being channeled properly and is going elsewhere. That's why you start seeing somebody having yellow eyes. The bile is entering the skin and other wrong places. Meanwhile, the stool is left behind. There's a problem with the digestive process, and then the stool starts coloring, clay color and pale, very pale. It doesn't look like, in fact, if you see it, you say, this kind of abnormal shit is this now. Now, wow, that is it. So that shows a liver condition and should not be taken for granted. Such person should report to the hospital immediately for urgent treatment, because the liver is a very vital organ, and if there's any blockage, anything, needs to be arrested immediately so that the person can begin recovery. Then next is a black stool. A black stool. Some people will stool and see black stool and they'll be sure that, Jesus, what's going on? Don't be scared. Sometimes it can be traced to what you took. Like I told you in one of my videos, that certain food have some dye or food dyes that they put in certain food can affect the color of the stool. And I can remember taking this hibiscus flower juice. It also have this effect. Hospital is too far a drink. In Nigeria, there's a lot of things that have food dye. Beetroots, fruits, give your stool that color. So taking all those things, then just relax. Over to where it is just those food items that are giving your stool that color. But if you didn't take them, it could point to another thing. It could mean blood in the stool, and blood in the stool points to a lot of symptoms, which I will share in another video from my discussions and interaction with certain patients. Blood in the stool, don't take it for granted. The next one, for the blood in the stool too, if you took iron supplements, they'll say take this one to boost blood. All this blood, this thing, both whether native one or the ones that is being bought from over the counter in the pharmacy, the way those things are produced, they have effects on the stool. They can, they have this dye effect that can make the stool kind of blood, like looking black, and so on. Then the last but not the least is a greasy stool. A stool that looks like grease, like plaster. I don't even know how to put it, like cement. I don't even know how to describe it, but the stool is floating on the water of the toilet seat. Normal stool will land this side and bam on the down, but this one now is floating on top. That stool points to a disease condition. It points to pancreas disease. And now, what's this pancreas? This pancreas is located on the under the lower part of the stomach, and what its function is it helps to release what they call insulin that helps to manage blood sugar. Now, if that pancreas has a fault or is not functioning properly, it leads to this problem of greasy stool that is floating. You'll be wondering, what kind of mucus around my stool? Please don't take it for granted. So if you enjoyed what you watched in this video, please like, subscribe, share this content to people that will be helpful. And if you have some other topics you desire that we explain further in points, some facts, some questions on your mind, you can drop it in the comment section. I will respond to them. Thank you so much for watching.